A powerful cyclone is complicating the health crisis in India. At least 24 people are dead and close to 100 others missing after Cyclone Tauktae slammed into the Gujarat coast. Hundreds of thousands of people are without power. Tauktae is the most powerful cyclone to hit India in 2 decades. Health authorities had already been struggling to cope with the coronavirus surge. They are now rushing to clear roads to make sure oxygen supplies to hospitals are not disrupted. 200,000 people have been forced into evacuation shelters. They've all been tested for COVID-19 to limit the spread of infection. At the same time, the number of coronavirus cases has surged past 25 million. But daily infections continue on their downward trend, with about 263,000 new cases today. And Ishan Garg joins us live now. Ishan, safe distancing is a huge challenge in these evacuation shelters, isn't it?
Absolutely. I mean, the number you just pointed out, 200,000 people, they've been evacuated. A number of them have been placed in these centers where they've been tested for COVID-19. But the problem really is that a number of these tests have been conducted via the RT-PCR method, and the results for them could take up to a few days. Now, that would mean that the government will have information about who does test positive, if anybody tests positive among this group of people, but that time would be enough for a potential cluster of infections to break out. And this is something that India had faced just this time last year when the cyclone Amphan had landed on the eastern coast on the Bay of Bengal, and similar problems had risen up at that time as well. But this time around, we are seeing that a bigger toll is being taken on the public healthcare system. We are seeing that vaccination drive had to be suspended both in the state of Maharashtra and Gujarat. And at the same time, oxygen manufacturers are also sounding the alarm, saying that because of the cyclone, power lines could get disrupted, which could mean that oxygen supply to many hospitals could also get disrupted at the same time. And hospitals, of course, are also worried that because of power failures, they might be facing some troubles later in the day. But now government is saying that the worst has actually passed, and that whatever preparations they had done, that they have all come in handy, and the worst actually is now fortunately behind us.
Well, like what you've said, Irshan, the worst is behind us. But does that mean that the federal government is back to focusing on vaccine supplies?
Absolutely, it does seem like it. Prime Minister Narendra Modi held a meeting with the district magistrates, or top bureaucrats of the areas that have been worst hit by COVID-19, and he made a point to tell people how important vaccinations are going to be. He has also urged everybody to take up vaccines and not believe in any myths or rumors floating around about COVID-19 vaccines. Now, it does come at a time when India is facing a severe shortage of vaccines, and the government is, Prime Minister Modi says, trying to secure more and more doses. He's said just today that that's going to be priority number 1 for India. The government has previously also said that by the end of this year, they are hoping to secure about 2 billion shots. Now, public health experts are saying that that's not going to be a reasonable number, because 2 billion shots from at least 10 different manufacturers, many of whom have not even started producing their vaccines, and they are still pending approval. So that figure, what the government is aiming for, might not be reasonable. But at the same time, they're also pointing out that what the government needs to do is start the import of foreign vaccines. Now, government says that it's been in touch with Pfizer and Moderna and Johnson & Johnson in hopes that these vaccines will be able to hit Indian shelves in the next 2 months.
All right, many thanks for those updates. Ishan Garg there reporting from New Delhi.